A few months ago, at an event that I was hosting, I met a woman named Lisa. She was brave enough to share her story about how she was infected with HIV at an early age, in the early 1990s by her husband. And at that time, she explained that HIV was highly stigmatized, and she often would hear negative comments from her family and friends about people living with HIV. Things like, oh, people living with HIV, they got that juice, they got that Kool-Aid. I don't want to even eat the food that they prepare. And so naturally that made her feel very uncomfortable even sharing her status with her children. But what stuck out to me was about her story was the fact that when she went to the health department, she was seeking treatment for HIV, and the officials told her that she needed to go back outside and walk around the building and go to the side entrance. Now, when you hear about somebody telling you to go outside and go to a side entrance, what immediately comes to mind? So, ironically, at that same event, there was a woman there who worked at the health department around the same time that she was seeking treatment. And she said, well, the officials, we were trying to come up with a solution that was sensitive to the stigma of HIV. And we were trying to protect people's confidentiality by coming up with a separate entrance. But the problem with this solution is that it ended up exacerbating the stigma and probably made other people living with HIV not want to go to the health department to seek treatment. And it was developed from the top down by people who knew a lot about HIV treatment and how to treat the disease, but not a lot about what the community wanted and needed. And this actually happens quite often among researchers who have a lot of knowledge about how to treat particular issues, social issues, and diseases, and they come up with these ideas to test them out and see if they work, but they're never actually consulting the community. And so we end up with this problem of having an abundance of resources, but very slow and ineffective results. What might have happened if we had used crowdsourcing instead? Crowdsourcing is this bottom-up approach that's gaining traction. It's a way that you can have the public contribute their ideas and work together to solve problems. And one way you can do crowdsourcing is through contests where the public contributes their ideas to solve a particular issue. Some examples in popular culture are the Wikipedia and Kickstarter campaigns. So I was tasked with developing a project that used crowdsourcing to improve community engagement for HIV cure research. Now, when you think about HIV research, you normally think about studies that are trying to develop medications to improve the disease and its symptoms. But HIV cure research is trying to eradicate the virus from the body altogether, or at least get to the point where people can go into remission and no longer have to rely on taking medication. But beyond just the medication, we also have to think about the social issues that might shape the future of HIV cure research. In order to really address those social issues, we have to ask tough questions, like, who is the community that needs to be engaged? What would make them want to talk about a stigmatized topic like HIV, or even participate in crowdsourcing contests? What's unique about Durham as a local context? And finally, how does the community want to be engaged? So we started off with the who. We know that African Americans between the ages of 18 to 35 are at the highest risk for HIV in the United States. They represent 45% of AIDS cases. But there are subgroups within that population that are also at the highest risk, including transgender women, men who have sex with men, and also heterosexual women and men who are in non-monogamous relationships. We also have to think about Durham as a local context. So Durham is the third highest county in North Carolina for HIV infection rates, and number 9 in the country for AIDS-related deaths. But at the same time, we are known as the city of medicine. We have the technological innovation and entrepreneurship, and we are a global hub for HIV research and clinical trials, and also HIV cure research. So we have the resources that are necessary to actually eradicate this epidemic. But there are some barriers to participating in HIV research. As we were talking to community members, a lot of times they would tell us that there was fear and apathy and feeling disconnected from researchers and research. And they also felt like they needed to have a certain level of intelligence or knowledge about HIV in order to feel like they could contribute to a crowdsourcing contest. But there were also motivators to wanting to be a part of a project like this. They said that they wanted to help the community. Altruism was one of the biggest motivators. They wanted to find a cure for HIV. And so when we ask people what does a cure for HIV mean to them, this quote really kind of sums up this sentiment. A cure involves shifting the underlying challenges of stable relationships and communities that has made this problem of HIV ravage the African American community. A cure is not just about medication, but it's about social justice, equity, and making sure Black life is protected. That's my favorite part. A cure is not just about medication, but it's about social justice, equity, and making sure Black life is protected. So that's where we started. So I started to reach out to people in the community who I thought might be interested in participating in this project. And we decided to host focus groups to get feedback on every aspect of the project. What's the name? What should be the hashtag and the colors that we use? And how should we market it to African Americans between 18 and 35? I was really excited about this, and I was like, okay, this is a great idea. People are going to come. Everybody's going to be on board. The first focus group, we had 5 people show up. But I couldn't let that discourage me, and we used that opportunity to really get some in-depth and positive feedback. And so we started to talk about how hip-hop and music and art and social media could be great ways to get this demographic involved in an HIV-related project. And so on the bottom of the screen, you can see the logo that we came up with based on the feedback. And the logo represents multiple things. It's a target, because we have a goal. We want to cure HIV. It's having a piece of the pie, so you can have ownership over this project and finding a cure. And it also kind of looks like a record, which it has a reference to hip-hop. But I also had to take a step back, given the fact that there wasn't a lot of people who came to the first few sessions. I had to take a step back and think about how could I better reach people and get the community on board for this project. So I set up a meeting with a friend of mine who was doing another community engagement project in the area and asked him how he built his project from the ground up. And he said, you literally sit one-on-one with people in their houses and at cafes, and you ask them about their day. You ask them, what's going on? How are you feeling? And what are you interested in? What are your goals? And then through that conversation, we started to see that there was overlap in interest, and we started to try to figure out how we could collaborate to partner together to build this project. So that's what I did. I created a list of people that I knew who were in charge of community-based organizations, local businesses, and community leaders. And we met and we talked and we figured out how we could work together to build up this project. And so over the course of 10 months, we developed partnerships with over 25 HIV-related community-based organizations, local businesses, and community leaders. And the community partnerships ended up being one of the most important parts of this project because they had access to the community in a way that I couldn't reach on my own. And at this community partner retreat that we had, some of the feedback that we got from the people who were attending said that this was one of the first times they had ever been in the same room with HIV prevention, treatment, and cure researchers, cure scientists, community leaders, and local businesses all in the same room, strategizing, working together to talk about how they could collaborate to reach and find a cure. Because most of the time we work in silos. We don't know each other, and oftentimes our efforts are not coordinated. And so this project served as a connector between these groups, and crowdsourcing served as a connector between these groups. In an effort to collaborate with the organizations, we set up times to figure out how we could do events together, community engagement events. And these community engagement events, this is one example. I sat down and the first event that we did was with a woman who was trying to start her own business. And she was trying to start a business that used education and African-centered philosophy and combine it with music. So she had access to hip-hop artists, and we pulled together an event that talked about conspiracy theories about HIV cure and how that tied into the community. And so at that event, we had the audience ask their questions and concerns about the conspiracy theories about HIV and HIV cure, and then we worked with the hip-hop artists to create a song together. And then they moved into freestyle and cypher. And so also based on the themes from that conversation, we then also developed the fact versus fiction HIV cure handout that you see above. And that was developed based on the conversation, is developed by the community. And we then used that to disseminate at future events. Some other types of events that we hosted were an open mic for HIV awareness. We did a Transgender Women's Day of Empowerment. We did a pain conversation led by a local teen artist. And we also hosted an award-winning forum on the issues that Black women face and how that particularly pertains to HIV cure research. Our first contest, one of the challenges that we faced was that people didn't know about HIV cure research, and they didn't know what crowdsourcing was. And so a lot of times we had to use those events as a way to educate people about those particular topics. But we also used the crowdsourcing contest as a way to get community feedback and submissions, creative submissions, art, music, poetry, and songs, and whatever they could come up with, reflecting on the theme, what does HIV cure mean to you? And that contest was used as a way to then create a campaign that raised awareness about HIV cure research. And so you can see some of the examples from the submissions that we got. And it also kind of showed this direct connection for community members who submitted these ideas. It showed a direct connection from their ideas to then turning into a marketing campaign, right? So they saw the direct results of their work and their ideas being celebrated. We also had to pay attention to the feedback that we were getting from people saying that they wanted to know how to better use technology to improve HIV work and knowledge about HIV. So the second contest that we did was a crowdsourcing contest that asked groups to come up with a sustainable business model that used technology to improve community engagement for HIV. And so the winners came up with an idea for an app. And so now we're currently working with them to turn that idea for an app into reality by connecting them with networks and resources. But beyond just the crowdsourcing contest, we also had to pay attention to some of the social, political, and economic conditions that put people at risk for HIV in the first place. Some of the things that I really had to take a step back and learn was, and swallow a pill, is the feedback that we got from people living with HIV. Miss Lisa and her friends told me they were actually coming at that event that I was talking about. They were coming to the event. They had to take the bus from North Durham down to Chapel Hill. And that bus that they took didn't take them to the venue where we were hosting the event. So I had to go pick them up and then take them to the event. And that issue of lack of access to transportation and the transportation system not being effective for them to be able to reach an event that's hosted for them is one example of a challenge that we have to pay attention to. And so they gave me feedback and said that we need to find venues that are easily accessible to the community and in their communities. And Ms. Lisa also told me that we need to have people living with HIV talking about their experiences and not just relying on researchers to talk about issues. So at the very next event that we hosted, we had Miss Lisa and her friends go up on stage and talk about their experiences. And now we're working with them to develop the next crowdsourcing contest and the next community engagement events. So this project is gaining national attention. And we've over the course of the past 10 months, we have collected over 40 contest submissions. We've reached over 700 people at in-person events, and we've reached over 200,000 people online. We've had celebrities who've reached out to us on social media and volunteered to endorse our project and endorse the idea of community members being involved in HIV cure research. And even though our project has a local focus, it has a global impact. We are a pilot project to be implemented in Cape Town, South Africa, and Guangzhou, China. And we're also working with HIV cure scientists in Bangkok, Thailand. So this project, the idea behind crowdsourcing harnesses the strengths of the ideas in the community. People from different walks of life, from different educational levels, from income levels, from socioeconomic background, from different races and sexualities and genders to work together to come up with ideas that work for their community. Now, I want you to close your eyes, and I want you to think about a world without HIV infection. What does it look like? And how does crowdsourcing help us get there? Thank you.